as a pediatrician, the most common symptom encountered in your clinical practice is sore throat, odynophagia. Whenever any child is brought with sore throat, invariably, my grandfather used to give erythromycin to my father. My father used to give azithromycin to me. Do you think that I am going to give clarithromycin to my child? No, it is not so. Do you think that each and every pharyngitis is bacterial? It is not so. Do you think that only infections will produce pharyngitis? Again, it is not so. Whenever any child is brought with throat pain, whenever you want to see the throat, and the throat can reveal the following thing. What is that? Erythema, edema, exudate, enanthem. When all these four things or one of these four things are present in the local examination of throat, it indicates that you are dealing with a case of pharyngitis. It can be bacterial, it can be viral, it can be autoinflammatory, or it can be a connective tissue disorder. There are so many possibilities when you examine a sore throat for pharyngitis. Thus, discussion is going to decode each and everything as a clinician, so that you need to choose a right case of group A β-hemolytic streptococcal pharyngitis and start your beta-lactam group of antibiotics to prevent acute rheumatic fever. With this introduction, let's see what are all the topics that we are going to discuss in the current session. What is a bacterial pharyngitis? What is a viral pharyngitis? Do a pharyngitis require steroids? What do you mean by prolonged pharyngitis? If a pharyngitis recurs again and again, what are all the things that you need to think of? If mother asks you whether my child requires tonsillectomy, what will be your answer? What antibiotics to be chosen? What antibiotics should not be given? And do I really need an investigation to start an antibiotic in a case of pharyngitis? These are all the agendas of this discussion. Come on, let's go and decode. Majority of the pharyngitis that you see in your office practice are viral pharyngitis unless otherwise proved. It is viral, it is not bacterial. But 90% of those viral pharyngitis are getting antibiotics. How to know that we are dealing with a case of viral pharyngitis and not bacterial pharyngitis? The answer is very simple. Remember 3C. Whenever, along with sore throat or odynophagia, when you have Coryza, cough, conjunctivitis, even when one of these three C's are present, it is viral. I repeat, Coryza, cough, conjunctivitis. Along with that, extra-pharyngeal manifestations like diarrhea are more in favor of a viral pharyngitis rather than a bacterial pharyngitis. I repeat, whenever you have cough, Coryza, conjunctivitis, palatal ulcers, more in favor of an enteroviral infection. Hoarseness of voice indicates laryngitis. Only bacterial infection that can produce hoarseness of voice is diphtheria. Otherwise, majority of sore throat along with the hoarseness of voice is viral. So if the child is not sick, no membranes are there in the throat, in the presence of pharyngitis and hoarseness, a simple observation is required. Almost all virus infections that you know, adenovirus, coronavirus, metapneumovirus, parainfluenza virus, flu, all will produce pharyngitis. No need to remember this one. But to my children, please remember, I repeat again and again, cough, Coryza, conjunctivitis, palatal ulcers, diarrhea, hoarseness of voice literally rules out a bacterial infection. Please do not start antibiotic even when one of these findings are present in the sore throat.